when you got to the point when you were like, I don't believe in rent control, and I think there is an industry in place to maintain the homeless population and maintain homelessness, like it's an industrial complex in California, my jaw dropped and I was like, oh hell yeah. Because here you are as a Democratic senator in Idaho saying, look man, I've seen the darkness.
Right.
Like I've been there. I've witnessed it. We can't go down that
and
road.
We're heading that direction unless we do something.
God bless you. So talk to me about this because again, people like me, I lived in Oakland and Berkeley from 2000 to 2012. I lived with like people defecating on sidewalks. I lived through the origins of the Occupy movement where like that's really where the tent cities came from, where people congregated and then it was this political commentary and we couldn't clear them out. And then laws got passed to make it like, it used to be like if you parked your stuff on the sidewalk, people get rid of it. And then sometime around like, I think it was 2010, there was this mass legislative movement like, no, they're kind of like engaged in political speech. Like you can't really steal their stuff. You can't move their things. And all of a sudden people took over, you know, either with RVs or physical tents or whatever. And you know, like California's very mild climate.
And just leave them.
Yeah, and you just had to leave them alone in peace to do whatever they want. And then it became this open drug scene.
Big safety, hygiene problem, public health issues.
Right.
Yeah.
And that, I saw all of that firsthand. Like we would walk, my wife and I would walk to get a coffee and a split a muffin every morning before we had kids. And this was in Berkeley. And we just saw it get worse and worse and worse. So,
and everyone here knows it too.
Yes.
You know, we talk to any Idahoan and they're like, yeah, I've been to Seattle. I've been to San Francisco, Portland, Los Angeles, most big cities in the United States. There are tens of thousands of people living outside on the streets and sidewalk. 1 million people in the United States. It's a very common problem. We don't have that big of a problem here in Idaho, and we can solve it, but we have to do something.
Right.
Because the main cause is rising cost of housing. But, you know, the way now that California treats homelessness and addresses homelessness, there's no way at this point of getting out of it. They're paying for hundreds of millions of dollars to essentially keep people homeless.
Okay, listen, I'm going to shut up. I want you to go. You spent years in San Francisco.
Yeah,
boots
3
on
years.
The ground.
I was working for a technical assistance firm. So we basically, which is part of the complex, most
the
of
homeless complex.
Yeah, the homeless industrial complex.
Yeah. Okay.
Which is what we're talking about today,
Sure.
right? And solutions too, I think that Idaho can implement to try to avoid that from happening here. But
right. What did you see when you were there? Like what happened?
So I was working for a technical assistance firm, and we are kind of the middleman between federal government, state government, and providers to try to address the problem of homelessness. We had 30, 40 staff getting paid pretty decent salaries to basically help these providers navigate the complexities of utilizing federal funding to solve homelessness.
Okay, so back up. So you guys had 30 to 40 full-time staff that were dedicated to helping service providers that were gaining grants from the federal government.
Mostly the feds, some state. Yeah, we would help them get some state money, but there's so much complexity around it and navigating these grants and how you manage the grants that most of these providers have to hire these technical assistance firms, or local governments will hire technical assistance firms to help them navigate how to comply with the funding.
Okay. So say I'm a guy, I'm like, I'm an organization that wants to provide sleeping bags. Okay. And there's a federal grant that will supply me with money to get these sleeping bags. And by the way,
good luck.
Okay. So I'm like, hey, we have 10 people that want to draw salaries, and we want to draw salaries from these grants and then supply these sleeping bags to these homeless people. It's so complex that even within our 10-person organization that's funded completely by these federal grants, we can't figure this out. So then we take a portion of the grant money and hire a technical. So we're like, okay, you guys have to help us understand how to get money from them and supply all of us with, supply all the people working there with salaries, benefits, retirement, so we can deliver a sleeping bag to that guy over there.
Exactly. The federal grants are so complex, and let me be clear. Federal funding is necessary to solve homelessness. I think we need federal dollars, and we know what it takes to solve homelessness. So we know what solutions work. And those solutions are usually what federal grants fund right now. Rapid rehousing. So that's one intervention that provides people that are homeless, who are very high needs, with time limited rental assistance, 3 to 24 months usually, and supportive services to get them out of homelessness. There's permanent supportive housing, which we can talk about because that's a very complex and controversial topic, right?
Sure.
Is a long-term subsidy for permanent housing for people, usually dedicated to people that are high utilizers, have been homeless for years, not capable of being self-sufficient or financially independent. They get those not time limited, they're lifetime essentially subsidies. And then you have some money from HUD going to homeless shelters, and then other funding. But there's also money for homeless prevention, which is what my nonprofit does. But each of these funding sources is very complex to navigate. You have to have, detailed policies and procedures when you're serving a client. Just for example, if we
when you're serving the client, that's the homeless person.
The homeless
client.
person, yeah. So the person who's homeless, or it could be a tenant if it's homeless prevention, or they're in housing with rapid rehousing or permanent supportive housing. So when you're serving that client, you have to keep detailed records. You have to have a really detailed checklist of all of these requirements that the federal government requires. You have to show documentation. You have to get documentation from the landlords, documentation on the tenants' income, situation, very detailed case notes. And then your program policies also have to comply with all of these requirements that they have as well. And you have to, train your providers on how to use these things, how to understand them. There's so many boxes to check and hoops to jump through that there is, I would argue, a lot of waste spent to address homelessness, because you have to spend so much money just to understand how to navigate federal funding. And because of that, some providers have stepped away and said, we're going to just try to go more in the direction of private funding. This is too much trouble. You've got to do annual audits with all your federal funders. They're, looking at every single file that you have in great detail, these 20, 30 page files that you have on these clients. They're trying to find something that's wrong with the way you're administering services. And what I would say is, we know what it takes to solve homelessness. Get people out of homelessness.
Sure.
Give them supportive services. So a social worker that walks them through, how to set up a budget, how to make a plan for the future, why it's important for them to not end up in this situation again, what barriers they need to address within themselves so they can be financially independent going forward, or stay in housing, whatever they are able to do. And then money. People need money to get out of homelessness too. It's those two things. And we add so many layers of complexity on top of that. And I understand why, in part. Society is complex. We've got to create uniformity. We have to have consistency. We have to make sure there's not fraud. But I do think from the way things get translated from the top down, from the federal government to the place service providers are at, there's just so many layers of bureaucracy that have been created.
Yeah, just hearing you articulate all of these different, again, boxes to check. So you're there years ago. You're working for this technical firm that's helping these providers. And again, the motivation of the providers is that, like, we can get an organization to function. Everybody gets paid. We have to be serving a client, and that client is the homeless, or short-term tenant, or whatever it is. And there's an abundance of clients. Like, if you want to start a restaurant and you're like, I need people that want to eat food, I got to go where the people are that like, Italian food. Like, I'll open it up in the Italian part of town or something. So for the providers, they're like, okay, I have a bleeding heart for homeless people. I want to spend my time doing this, not as a volunteerism, but like, I want to make a business, be it for profit or nonprofit, out of this. I want to use the federal funding. I have to go where the homeless people are. So you have a homeless population. And then you have these providers that come on top of that, and they're like, okay, these are all of our potential clients. And that then obviously, if you're a homeless person, and let's say there's homeless people stretched out across different areas, they're like, Okay, well, look, I can hang out in this place. There aren't very many people that are like eager to help me through this. But you know who's eager to help me through it? This provider way over here, which starts attracting theoretically more people. Where it's like, okay, and they have all these people and services that walk
Right.
through this stuff.
Well, so if you're getting federal funding, there's an added layer of complexity there about who you serve. So the
Do
federal
I have
government,
to be? Does my address or non-address have to be like closer to the providers?
the federal government require no, but you have to have certain vulnerabilities that are assessed using an assessment tool that the entire community has to agree to and utilize.
my
And you
gosh.
have to go through one access point and utilize that same assessment. So let me tell you.
So if I'm homeless, I might go to one of the providers and they're like, "You're not homeless and vulnerable.
you're not
enough."
homeless enough because you
That's a phrase. You're not homeless enough. Okay, go.
or you're
my
that is exactly how it works.
Oh my God.
So you have to have every community has to have what's called a continuum of care. That continuum of care is supposed to include every single provider that works in homeless services, definitely required to participate if you receive any federal or probably local funding if your local government's involved in the COC. That COC receives funding for what's called a coordinated entry system. If you are homeless and you want to access the federal resources, you have to go through the coordinated entry system. And I understand the reasoning of it in part because you don't want the reasoning is you want homeless resources to go to people that absolutely need them. Okay, so, and you want the types of resources that people need to match what they get. So you don't want somebody that was just homeless yesterday, they got evicted, lost their home, they've been living in their car for one night, to get a very coveted spot in a permanent supportive housing building over someone who has been homeless for 20 years sleeping on the streets. And there are reasons for this.
Wait, so the 20-year vet who's like, I've been out here for a while.
I've
been
first
putting
in
in my
line.
time. I put in my app 2 decades ago. That apartment's mine. And you're like, yeah, man. Yeah, the apartment's yours. And then the other
Well-
person who's like, I just slept in my car with my kids. Like, let's say my spouse died or they left me and I'm like, I have all these problems. I need housing. They're like, you ain't homeless. You
They're
haven't
not-
suffered enough here.
They're not prioritized.
You're not homeless enough.
They are not prioritized. So you have to,
Okay.
every person that is homeless has to take an assessment that has to be adopted by the continuum of care. It's usually called a vulnerability assessment. And there are lots of different assessments that have been used. Some of them are very long. Different localities have like a 20-page questionnaire. Some just have a 1-page. We in Boise have like a 1-page questionnaire. It's pretty simple. But from that questionnaire, the homeless individual or family is scored. So they get points based on their vulnerabilities. So if you have a disability, you might get more points. The length of time you've been homeless will give you more points. If you're a survivor of domestic violence, you might get some. It kind of depends on the community and what they prioritize in terms of vulnerabilities. A lot of communities will prioritize people that are high utilizers.
Yeah, by utilizers, you mean drug addicts?
No.
Okay.
That's a great question.
Okay, because you
High
mentioned that before. I was
utilizers-
like, what's a utilizer?
High
Okay.
frequent utilizers of services, meaning they have used the healthcare system or the first responders, basically been in the ER or encountering with, police or things like that frequently. A lot of times it's folks that are costing the health system a lot of money. And the reason is because they're costing the community more money. We
And
want
they
to get
attribute
them.
that to homelessness. So like, hey, leaving them on the street will cost us as society
More
through
money.
ambulance visits, through hospital visits, through all these things. We should get this person off of the street, and that would be a net benefit financially
It does.
for us. So like, if somebody's a high utilizer and they've been homeless for the same amount of time who's somebody who's not a high utilizer, who's like perhaps
Yep.
not ending up in the ER, not calling
And
the
they can
ambulance.
be self-sufficient. They can probably figure it out on their own at this point, right? The person that's been homeless for one night, they can maybe even just get $1,000 to get into a place and be okay. They don't need a permanent voucher for the rest of their life. Whereas someone who is a high utilizer probably does. But here's the thing. So we've talked about the cost of homelessness that the federal government puts on just through bureaucracy. There's an administrative burden to maintaining homelessness, in part because of the federal government, but also because the problem is extremely complex and there's so many different providers that you have to coordinate. There's another cost of homelessness that is just the fact that homelessness exists. There are things that we need to do around homelessness that cost money. Like San Francisco pays about $100,000 a month to clean up, poop and needles from the streets.
That's it? I would have thought
probably
it was more.
It probably is more.
It was more.
When I was there 5 years ago, it was something around
It's
there.
definitely more now.
It's
I don't know what
probably
it is, but it's more now.
It's more now. The cost to run a shelter, and then the cost that I'm getting into, which is the cost that homeless people who are homeless are to the community in using services, which is usually first responders, healthcare systems, things like that. So we did a study here.
May I say
Yes,
something
please.
real fast? I have a brother-in-law who's in the Berkeley PD, and years ago he told me we had rain, right? And in rain, he's like, oh, here it goes. I was like, what's happening? He's like, oh, the second we have a big rain, every homeless person in the city says they have chest pain, an ambulance comes and they like pop them into a bed in the hospital.
Or they'll intentionally, some folks will even get ticketed so they can spend the night in a jail to have just a warm place to sleep and a roof over their head.
So, okay.
And so,
it.
I mean,
so that's a high utilizer.
Yeah. And so our community actually, in a lot of communities, a high utilizer might cost upwards of $100,000 a year to the community. And that's the cost of county services, city services, nonprofits, and hospitals.
And that's just one person.
One person. In our community, we did a study that each person who is more chronically homeless, we have, I mentioned last time about 2,000 people in Ada County that we know of that qualify as homeless, technically, under the federal definition. And of those, we have a subset of folks that are more chronically homeless. So they've been homeless for a longer period of time. We know, we did a study with the Idaho Policy Institute through Boise State some years ago that showed that each person costs the community $53,000 per year.
Each chronic homeless person.
Yes. So we built, permanent supportive housing more recently here. Our first attempt at this new path that housed 40 of the most chronically homeless folks in the community, those high utilizers. Frequently utilizers, whatever you want to call them, and folks that have struggled more than others. And we housed 40 of the top folks, and in the first year saved the community $1 million. Over 5 years, saved almost $9 million.
Okay.
So if you can get them out, those folks out first. So there are reasonings the federal government builds some of this bureaucracy. It creates challenges, but if you can get those higher utilizers, especially attached to the more permanent subsidies first, get them out of homelessness, you do end up saving a lot of money.
Was this I don't know anything about this, but I do know that there was discussion of people in the city of Boise housing homeless people at like a hotel in the last, summer.
Yes.
Was this that program?
No. So
okay, because that one did not sound
that was
like
kind of more
Ada.
like hotels were being treated like shelter.
Gotcha,
Just to kind
gotcha.
of expand the shelter, because during the pandemic, we didn't want folks who are homeless out on the streets, spreading the illness and getting the illness. And
Sure.
all those things. So we used
So different
COVID
stuff.
money to just kind of expand the shelter with a hotel.
Gotcha.
But that was temporary. New Path is a permanent supportive housing building, like a project that we built with community partners several years ago. And yeah, it's still there.
One thing that people I know are worried about is that you create something like what you're talking about, like a new path, like an actual physical project that with the intention of getting chronically homeless people on, and we have some manner of subsidies, and we make life better for them by being like, okay, you're not going to be sleeping in like outside in a Boise winter or whatever, right? Or not going directly to the emergency room every time it snows, and like not all of these things, or getting ticketed, whatever it might be. But they're
and
also
getting health needs addressed too, because a lot of these folks have really serious health issues, so they're in the hospitals a lot.
okay. So what is to be done? Is there any ask of them? Because I know a big concern that people bring up over and over and over is like, let's, like Reverend Bill Roscoe, like, listen, we don't even have, you know what blew me away about him when I met with him? He's like, we don't even have time limits. I was like, what do you mean you don't have time limits? He's like, if somebody's in our program and they're making progress, we have no limit of time where it's like, really you got to be done by this time. And I was like, isn't this the number one criticism? He's like, no.
Because a lot of shelters max out the number of days.
That's right.
Stay.
And he's like, listen, as long as they're sober and making progress, we will stand by you. And that could take 3 months. It could take 3 years. And as long as you're sober and fighting the fight, like clawing forward for your life, we will not let you down. He's like, now, if you relapse, if you just want to drink, if you just want a place to stay overnight and keep going, like, we're not your jam. But if you want to make progress, we're here for you. And I found that so beautiful and so counterintuitive. I was like, wow, I had not thought about that. But I know that's a concern that people have, which is like, when we start providing community funded housing for people, are we allowing or perpetuating open drug scenes?
Right. So permanent supportive housing does include services. It is a challenge to get people to engage in services. I'll just say that out loud. It's true, because a lot of these folks have been living outside, sometimes for decades, and they haven't lived in housing. And they don't want to be told what to do. They want to do things a certain way. So, but there are services on site or mobile services, depending on how this housing is set up, if it's scattered site or project based. And services are available to folks. They are expected to engage in those services. Case managers will constantly talk to folks, try to get them to, improve their situation however they can. There are things called move on programs with that. So folks will try to get basically from this permanent supportive housing voucher to transition onto a kind of a different voucher, like a Section 8 voucher, where they're expected to put 30% of their income towards their rent, and the rest is kind of covered. So they'll try to get them engaged on that, and get them to be as financially independent, self-sufficient as possible. But I will say the folks who are prioritized for these permanent housing vouchers are in a pretty difficult situation, usually health-wise. They have some severe disability. They're much older, things like that. So they're not really able to go off on their own ever, especially if they've been living outside for decades. And some of that's because of, maybe just how they were born or raised, or some of it's because they were homeless for that long. They're just not in a place where they can be self-sufficient. So the case management is always, case managers, social workers are working directly with these people. That's what people should know. However, you're kind of getting into the debate about housing first, because there is some debate about when people get into a housing complex like New Path, should we require them to stop using drugs, resolve their health issues, get a job, or whatever it is before they go into that housing? What research has shown and what providers will tell you from experience.
Yeah, if I may say it real fast,
Please.
If you're looking for somebody to get a job, resolve all their issues and everything, and then you give them an apartment, they wouldn't need the apartment.
Exactly.
If they had all this stuff.
That's what I was about to say.
I don't know anything about this, but it's like, listen, I'm homeless because I have a mental illness or I don't have a job. Like, if you want me to be this person who's doing all of these things right out of the blocks, then what am I doing hanging out with you? Like, I got it locked down. Like, I gotta, any of the more affordable, like, even if you want, and again, just like if you looked at the most economically viable, there was somebody showed me a mobile home a mobile home park. There was this beautiful mobile home that was like the single wide, and it was done really nice, had like nice flooring and nice walls and everything. And it was like, it cost $50,000. And I'm not saying like a homeless person goes from being homeless to buying it, but I do understand that there's a rental market around, mobile homes. And it's like, look, man, like if I was homeless, this would be a totally viable option. What you want, $200 a month? Right, for this, or $300 a month, like, I could probably scrap that together, and like, it was a fine place to live. Like, I've lived in much smaller, not as nice places, right? Like, no problem. And but again, that presupposes the existence of somebody who's functionally active within the community and like doesn't have all these other considerations.
Right. And those folks, like I said, they're not prioritized for those more permanent vouchers, because the goal is to get them to go out on their own. So they might be, if they're homeless, they might be prioritized for just one-time security deposit, first month's rent, and gotten into housing, or maybe a more 3 to 6 month voucher to help them gradually cycle off. So the first few months the program will pay 100%, then the next month they'll pay 60%, then 30%, to kind of cycle them off. And there's services involved with all of these things. Again, like going back to my original statement, solving homelessness is actually very simple. It's, we
get houses for people to live in,
give them money, and give them the services side is so important. And it is included in HUD funding and federal funding, and any homeless program. There's always supportive services that folks are expected to engage in.